Franks. I'm a consultant old age psychiatrist in the Trust, and I've been a consultant here for 14 and a bit years. And the reason I wanted to be involved with this is because I've got a recurrent depressive illness, so I have periods of depression interspersed by periods of being well, fortunately, and I just wanted to raise a bit of awareness and let people know a little bit about how I've coped with that and how things have helped me cope with that. In terms of my illness, I first got diagnosed when I had some period of postnatal depression after the birth of my second daughter, who's 15 now. But in retrospect, I've probably had a couple of periods of depression prior to that I hadn't really realised. So obviously it's affected me in different ways over the years, and I have had to have a couple of periods of time off work sick, the longest of those having been about 4 months, which is obviously quite a long time. But I found over the years I've got a little bit better at learning what might be pointers towards my mood dipping, and it's finding ways of both recognising that in myself and then being able to communicate that to other people and feeling comfortable to communicate that to other people. Thinking back over times, there's obviously been times when I've been obviously unwell and too unwell to be at work, and other times when I'm absolutely fine. The times in between can be a bit of a challenge, and they're not always, obviously there's times when you're sort of maybe on a phased return or something, but other times that can just appear out of nowhere where you're just not quite so good. And it's having people's understanding that there might be days when I'm only running at 50%, as it were, and that I can still work, but I maybe can't do as much as I would on a day usual to that, and for people to have hopefully a little bit of understanding and flexibility around those times, because I think there's people move towards a bit too much black and white thinking, that you're either perfectly well or you're sick and you can't be at work, but actually there's a lot of grades in between that, and managing that is very important in terms of helping people stay at work and feel that they're able to work through some of these periods. So in my experience, it's taken me over the years a bit of time to feel able to tell people about my condition and how that affects me. I think what's been helpful is for people to give me time to do that, allow me to do that in my own words, and not to treat it like a big deal. Although it's a health condition, everybody's is different. I think sometimes people can treat mental health problems almost a bit with kid gloves, and that can almost make it harder. I think there's also a sense of being aware that you don't have to fix it all yourself, and having other people reassure you of that, particularly when you're in a health professional, particularly for me as a mental health professional. It feels like I should be able to sort this, and I can. People's help is really important in that, and other people that I work with echoing that they can help and are willing to be supportive is very, very helpful. So in terms of having a recurrent depression, I don't feel like I have a disability. I probably wouldn't even think of myself as having a long-term condition, but actually I do. This is a long-term condition that has followed and will follow me through my life. And I think I was quite surprised and pleased when I found that the Equality Act applies to that, because that gives me some extra sort of supports and rights around work. I think it's important that people feel that they can share some of this information, not necessarily anywhere near as publicly as this, but if people feel that they can share either within ESR or in a fairly quiet way with managers that they do have whatever kinds of health conditions, including mental health conditions, it'll help us get the best support for everybody across the Trust. So I wanted to be involved in this video partly to try and encourage people to speak up just in whatever way they feel comfortable, but because that can help people access all sorts of levels of help that they might need. I wanted to make people aware of the Disabilities Network, the Ability Network, which to start with I didn't think applied to me, but actually I found it really helpful, and it's a really safe space. And I think the other thing I want to remind people is that with so many illnesses, and particularly with mental health problems, it's not black and white. You're not well or sick. There's a lot of areas in between that between us we need to be able to manage better to help people thrive at work.